Good morning, Saint Lucia. Good morning, members of the press. Good morning to the Honorable and the Honorable Moses Musa JnBaptiste, the Minister for Health, Wellness and Elderly Affairs. And we would like to apologize for the late start. There was severe flooding in of the city, but we are here and we do hope that the rest of Saint Lucia is safe and sound, and to please exercise caution on the road and please guard against any land slippage that may be occurring right now because of the heavy rains. This morning, I would like to invite the Honorable Moses Musa JnBaptiste, the Minister for Health, Wellness and Elderly Affairs, to address you. We know that a lot has been happening not only on the COVID-19 front, but in the health sector. Honorable Moses Musa JnBaptiste, please.
Thank you very much. Monday, Press Secretary to the Prime Minister. Good morning, members of the press. Good morning, St. Lucia. Prime Minister, Honorable Philip J. Pierre. Let me also say good morning to other members of the public services. This statement this morning is specifically about the COVID-19 pandemic and the actions which the government has taken so far to deal with the COVID-19 pandemic. As we speak, members of the command center are meeting, and as soon as the meeting is over, a report will be sent to the Prime Minister, and the people of St. Lucia should expect further announcements later today or early tomorrow morning. As we speak, I repeat, the command center, members of the command center are in a meeting and they are discussing the issues, the recent developments in relation to COVID-19. Here is my statement. Over the last 14 days, August 4th to August 18th, 497 new cases of the COVID-19 virus were reported. This new surge in COVID-19 cases, which have plagued St. Lucia and which have caused much concern to St. Lucians, greeted me as Minister with responsibility for health, wellness, and elderly affairs upon assuming office of Minister. We can tell you that the Prime Minister has deemed this crisis the most important health concern, but of course for the majority of St. Lucians, as we know, and it has been the #1 priority of the Prime Minister, Honorable Philip J. Pierre, and the government of St. Lucia. The people of St. Lucia put us into service on July 26, 2021, and since then, we have focused our attention on this COVID-19 pandemic. According to the Department of Health, a total of 6,578 cases have been diagnosed in St. Lucia from March 2020 up to August 17th, and 1995 unfortunate deaths have occurred. On behalf of the government of St. Lucia, I again express our deepest sympathies to the families of the deceased. To date, up to August 17th, there are 1,025 active cases in the country. As the Minister with responsibility for health, wellness, and elderly affairs, it is my responsibility to ensure that the policies and actions of this new government are brought to bear on all aspects of the general healthcare crisis in St. Lucia. And over the last 2 weeks, the following actions have been taken or initiated to both stem the surge in the COVID-19 cases and to strengthen the capacity of our healthcare workers to provide care to those who have been affected. The following should be noted. 1, as I indicated a while ago, more recently, as we speak, the center is meeting and we expect recommendations later today. 2, consultations with ministries have been ongoing, the bus drivers, and also with hotels through the Ministry of Tourism. NIMAC has met, and there's a national consultation on vaccination policy today at 4 o'clock, and this national consultation will be addressed by several experts. And the main concern here is vaccine hesitancy, and we will get explanations and contributions from many experts about this phenomena. In order to reduce infection rates, new protocols came into effect on August 13, 2021. I am advised that mass gatherings for social events are taking place, and the leadership of the Royal Saint Lucia Police Force have reviewed the situation with a view to ensuring that the owners and organizers of these events, some of them very well known, desist. The contact tracing information has demonstrated that most of the current cases, in fact, a large majority of the cases, have originated from very large social gatherings, mainly in the north of St. Lucia, and the age range most affected is the 25 to 49 age range. Social activities mainly in the north of St. Lucia, Grosile, Babuno, Castries. The Victoria Respiratory Hospital. Conditions at the Victoria Hospital are not acceptable. We are working with the director of the hospital and also Dr. Eugene, who is responsible for the clinical operations at the hospital. Additional staff is being mobilized, improvements to the oxygen supply system, installation of better communication equipment, assessment of and improvement to the supply of medicines, and an attempt to seamlessly connect the Victoria Hospital to the isolation operations in the field. Relatives of patients who are admitted to the Victoria Hospital speak of many gaps in the system which we must help the administrator and staff to fill, and we are working to fill the gaps. Increased testing and contact tracing. During the period January to March 2021, 17,527 tests were done. And between the period April to July 2021, 22,722 tests were done, an increase of 5,200 tests. We encourage more St. Lucians to get tested. We will increase the testing sites and are seeking support for additional supplies for testing. It is only when we test as many people as possible will we know the full impact of the COVID-19 pandemic here in St. Lucia. I am advised that the Ezra Long Lab now has the capacity to also numbers of tests per day with the acquisition of new and advanced machines. We're in the process of providing additional support to the contact tracing team and to the team which monitors patients in home isolation. Currently, we have only 1 doctor and 4 home isolation monitors for the whole of St. Lucia. We will change this situation and make it better. Vaccination. Our current vaccination rate stands at 14% of our total population for fully vaccinated individuals. 8% of the population have taken a shot. The Pfizer vaccine is now in St. Lucia, and the Department of Health will begin administering the Pfizer vaccine from Monday, August 23rd. We have developed a vaccination plan which will involve the media and other influencers, which we hope will encourage more St. Lucians to take the vaccine, especially the young. This campaign will encourage medical professionals to be at the forefront while using a variety of popular methods to carry the vital message of vaccination. More vaccination sites will be made available to the public, and the ministry is exploring other arrangements to get the vaccines to communities across the length and breadth of St. Lucia. For example, many people who work and who leave work at 4 p.m. have said to us they would love to have the vaccine, but they are working. So can we, for example, get the vaccines to workplaces, or can we have the vaccines available after working hours? These are all considerations that are on the table. The command center. The name of this body will change, and it will reflect the national effort to stop the spread of the COVID-19 virus. Members of the new body will reflect the technical and clinical nature of the COVID-19 problem, while also considering the social and employment impacts of the pandemic. Details will be announced next week. The Delta variant. Fellow St. Lucians, the presence of the Delta variant in St. Lucia means that we will have to be even more vigilant, and measures to stem the spread of COVID-19 will be more dynamic and more specific. This matter has become more urgent. The opening of school. Decisions in relation to the opening of school will be made after consultations among the relevant ministries and the Prime Minister after these consultations take place. The projected in the country by the date of school's opening and the related medical advice will guide decisions in that regard. The public will be apprised of the situation within reasonable time. Ladies and gentlemen, fellow St. Lucians, the Prime Minister, Honorable Pierre, has over the last 2 weeks led actions to provide the necessary support to the ministry's efforts, and I thank him for his attention in this matter. Thanks to all of the healthcare workers and other frontline workers who continue to put their lives at risk in this crisis. Our government is working to improve the condition in which you work and will pay attention to your suggestions and your needs. Thanks to the many citizens throughout St. Lucia who have joined the efforts at educating members in their communities. Let us all continue to promote safe behaviors and actions which will bring an end to the spread of the COVID-19 virus within our communities. I thank you very much.
Thank you, Honorable Minister JnBaptiste, for that comprehensive report on the COVID-19 management situation in St. Lucia. I would now like to invite the Honorable Prime Minister, Philip J. Pierre, to address us.
Thank you very much, Press Secretary. Good morning, members of the press. Good morning, St. Lucia. My remarks are going to be very brief, whilst I will entertain your questions. I just want to reiterate the point. We have decided that our approach to the COVID management is a more holistic approach. We are going to be involving people at all levels. We believe that must take responsibilities for the actions. We think by education and by discussion that we will, if we follow the science, we will bring the scourge under control. So what are we doing? We are having an increased vaccination drive. It's very simple. The science has shown that the vaccination plus the public health matters are the only way, for now, that will stem the surge of COVID. So our first approach is to get people vaccinated. And very soon, in fact, tonight, we're going to be having a discussion on vaccination. We cannot force people to get vaccinated, but we can tell them that vaccination may save their lives. There's going to be constant education and constant discussion and constant trying to get people to understand that they have to vaccinate for their own good and the good of their families. So that is our first approach. Cause people to get vaccinated, and we're going to make it easier. We have, at this point, we have a supply of vaccines. We have so people can have a choice as to which vaccination or which vaccine they want to take. So this is our first approach. Vaccinate, vaccinate, vaccinate. Second, test. And I'm heartened, I've been told that over the last 2 weeks, more people are coming forward to be tested. So what happens when people get tested? When they get tested, they either can be positive or negative. If they are positive, we need them to understand not a death sentence. So what are we doing? We are making the conditions of isolation more comfortable. In that they will understand that they haven't committed a crime, they haven't got COVID for themselves, they didn't look for it, but since they have it, we're going to make it more comfortable for them, either at their homes or at the hospital. If they are at the homes, they have to be more. What are we doing? We are increasing the monitoring capacity, so when people are at the homes being isolated, they can be monitored. But we are asking them to take responsibility for their own actions. It is their life. The science has shown that COVID is dangerous. COVID can kill you. Who wants to die? So people must take responsibility for their own actions. So this is why we are going to be increasing the monitoring. We're going to be increasing contact tracing. But the of this government is education, education, education. Education on the vaccination, education on the public health issues that we have to follow. So what do? We encourage people to wear your mask. Wear your mask. We encourage them. And they have to understand that it's for their own good. Nobody wants to get COVID. Wear your mask, vaccinate, sanitize. Very simple. Wear your mask, vaccinate, sanitize, and get tested. This is where we are going. We're going to put many more resources into that fight. But we believe, and we have confidence in the people of St. Lucia, that they will understand that the government cares about them, the government cares about people, and we need to get our economy. We do not need to have another outbreak or worse outbreak that will put the country into many more problems. So I'm very confident that with the work of the Minister of Health and the people, and I want again to say especially nurses and all the first responders, and you, the press, for putting out the message of truth, the message of unity, the message of getting this country together to fight this COVID scourge. I thank you.
Thank you, Honorable Prime Minister. And there you have it, St. Lucia. We are focusing on you. The public needs to trust the science, obey the COVID-19 protocols, and get tested. We have seen the uptake of testing, which is a good sign that people are now trusting the system. People want to know their status to get treated. People believe that they will get help when they are COVID-19 positive. So again, to reiterate what the Minister of Health and the Prime Minister has said, sanitize, wear your mask, get tested. You will be taken care of by this government. So now I would like to open the floor to members of the press for questions. Mr. Favre, please use the mic. Okay, Ms. Shalmine.
Good morning, Elsie Shalmine, Choice News. From my observation since the 13th of August, a lot of St. Lucians have actually been asking for more rigid protocols as compared to what currently obtains. And I think added to that, the confusion with the announcement of decriminalization, eventual decriminalization, has made people believe that the protocols are not strict enough or there aren't punishment attached to the protocols, for lack of a better word. The SLP's mantra is putting you first, putting people first, but is that contradictory if you're not listening to what the people are saying and asking for stricter protocols?
Well, I'm happy you're informing me that people are asking for stricter protocols. I'm very happy you're saying that, and then I'm going to consult the science and consult with the command center and see what can happen. I will not sit here and make a pronouncement without getting the full backing and without getting the full information from the science. That is how we're going to be moving forward. If the science leads to more enforced, or if the science leads to stricter protocols, I'll follow. And I just want to say something about this mass mandate thing. I want to ask you something. What's the last time you heard anybody got charged for not wearing a mask? Our system, our court system is clogged with thousands of cases. There are thousands of cases in our court system. I'll give you an example. In traffic cases, people who have and the police just don't have the manpower to prosecute them. So it doesn't make any sense that we create that level of animosity. Did you see that animosity, people being dragged for wearing a mask and the fights and things? What we're saying is that we're trying to encourage people to do what is right for them. And we think that the majority of people understand that what the government wants for them is good. And I believe in basically in the goodness of mankind. And I think by constant education and constant speaking, not coercion or force, that people will wear the mask, this scourge under control. But if it doesn't happen, then after consultation with the people who matter, the scientists, then we'll take another position. But I really believe, I have faith in the people of Saint Lucia that they will do the right thing.
Yes, the key word here is consultation, and to know that the Prime Minister does not make any unilateral decisions about protocols. They are informed by medical practitioners, by the command center, and by technical staff who are more equipped than us to make such pronouncements. Mr. Février?
Good morning, PM. Good morning, Mr. Minister. My question is for you, Mr. Minister, and I'll give the background after. Are you satisfied with the current reporting, the format of COVID reporting? Because through discussions with members of the public, they seem to think that some information is lacking and some has been omitted. I'll start with how many visitors foreign nationals do fall under those cases, because the argument is it's unfairly being labeled as domestic cases, and there's no distinction between whether it was on the ground or with visitors. Number two, how many asymptomatic individuals, I hate that person's word, how many individuals are asymptomatic out of the positive cases that we have, and how many are symptomatic? We get how many have died, who may have been hospitalized, but we do not get how many have been asymptomatic. So I go back to the question, are you satisfied with the current level of report, the format of reporting, and are there any, how do you plan to tweak that? Is there anything you can give us as to what you will include moving forward?
Well, thank you very much. The answer is no, and you will note over the last week or over the last few days of reporting, and if you compare the report to those before, you will note a change. In fact, the report is shorter, and you will note that there is a change. However, we continue to dialogue on the method of reporting, even the method of populating the flashcards and the information at a glance. So yes, we are continuing to consult on this, and we will standardize the reporting very soon. And yes, I agree with you. The information in relation to the number of visitors who have tested positive, possibly asymptomatic people, and so on, so that the people of Saint Lucia have a fairly good picture of what's happening. Also, the areas where the COVID cases are popping up, and we have that information because through the contact tracing process, we know where the cases are coming from, and we can actually pinpoint the social event. We can actually pinpoint the social event, and that is why the authorities know exactly where the majority of cases originate from. So, and I agree with you. Coming into government during the campaign, we promised the people of Saint Lucia that we are going to be open and honest, and we are currently reviewing the method of reporting. Thanks.
Thank you. Ms. Shalmine, you have another question?
Yeah. I understand the government's the plan to educate at this time. But given the trend in the rising cases, where for the past couple of days we've had at least 100 cases, is now the time to educate while the cases are rising, or is there not a need to clamp down and while we're doing that to simultaneously educate then? But if we still have people, like you said, at mass gardens in the north and the south, wherever, and we're trying to educate those people who are flouting the protocols, do you think that's going to work? Do we have that much trust in, the conscience of our citizens?
Well, the short answer to that is I do have trust in people. I do have trust, and from my personal experience, I can tell you, I do have trust in people. What I want to say to you is that we are not doctors. Minister of Health, nor myself, we nothing near. We are guided by the science, and we are guided by the advice of the medical people. We are working, and we will continue to work closely with the Saint Lucia Mental and Dental Association. There is no conflict as existed before between that body and the government. We are speaking to everybody. We're speaking to the doctors, and most of all, we are speaking to the social workers. We are speaking to the people who know what's happening in people's minds. Because there's a, you know, we as a government, we do not want to say things glibly. We want to be guided by information and guided by the science. And each one of us must take responsibility in encouraging our friends, our relatives to wear their masks. That's not only a job of the police. We can, and I'm sure the minister will tell you, when school reopens, we're going to put the education at the schools so children can advise their parents to wear masks and get vaccinated. And I must also say something finally, that the measures we've put in place have not been there for 14 days as yet. These measures, it's going to be 7 days on Saturday?
Friday.
On Friday. These measures have not been placed. So I'm very concerned, but let us be guided by the, let us be guided by the advice of the people who know, and let us not get involved in unnecessary panic that's not driven by science.
Okay, can I just add to what Prime Minister has said? I just want to remind the people of Saint Lucia that as we speak, the command center continues to meet. So based on, well, the Prime Minister said it, we are being guided, we will be guided by the science and information. And as soon as we get the report center, as soon as we get the report from this morning's meeting, we will certainly, the process will certainly kick in.
Yes. Devon Wall. Yes.
And a journalist. Since we're guided by the science, according to CDC data, obesity is a 30% indicator of a more prevalent chance of having a severe illness or death. And anxiety and fear-based disorders are also the second most common, with about a 28% increased chance of severe illness or death. I've heard a lot about vaccines, testing, but I've heard very little about healthy lifestyle, dietary changes, and especially the importance of vitamin B. That beyond COVID-19, our healthcare facilities have been strained with non-diseases, and that's been a plague on our society forever. Does the government, or what is the government's towards dealing with that aspect, which some may say will have a more long-term beneficial effect for our society? And second, a shorter question, you've mentioned that vaccinations will not be mandatory. By any chance, does that extend to the reopening of school strategy for children? Will they be also not mandated to take vaccines, or will that be something that is looked at?
Thank you very much. If I can answer your last question first. We are in discussions with the Ministry of Education, but for the time being, what is happening at the schools are going to be mask wearing. They're going to decide whether it's going to be a situation where you have smaller classes, and whether you have alternative days, and the schools are going to be thoroughly cleaned, deep cleaned. That's the position for now. But as I said, discussions are continuing, and we are going to be able to make a decision after the consultation with the Ministry of Education, what's happening as far as schools are concerned. But for now, there's no plan to have compulsory vaccination for children. There's been no plan at this time. Secondly, and I'm glad you brought a question about healthy lifestyles. The last time I spoke about non-communicable diseases and unhealthy lifestyles. And this is why we've had in the portfolio a minister for the elderly, where we're going to change their lives lifestyle, eat properly, eat differently, to exercise. And I'm very happy you're saying that. And I'd like the press to lead, to help us in this fight against these sorts of bad behaviors when it comes to lifestyle. But I'm very glad you brought it up, and the government is very, very, very interested in promoting healthy lifestyles. You may realize a few Sundays ago, my victory celebration was a walk in my constituency. And then we want to encourage that. I brought people to walk into the constituency. That is to encourage healthy lives. But that's going to be part of our fight, not only against COVID, but our fight for different health situation in Saint Lucia.
Yes. This is not a knock. I mean, we remember that the minibus sector had with the last administration regarding the numbers, and this is not a knock on them, but if the medical professionals are right, right now we're facing a clear and present danger with the minibus drivers at full capacity. If the numbers are rising, and although people wear masks, I can assure you that there's not much sanitation of those buses while they make their rotations. And I know you said that there's a meeting, it's going to be other consultation, but then what have the discussions with the minibus sector been so far in the past 2 weeks since you've been in office? You understand this is not a time for us to be having to be deliberating for a long period while people are crowded up in buses and everything. Is there some sort of discussion about recourse or redress for them? Are we looking at probably reducing numbers again and having a balance, some sort of redress so that they don't lose too much like they did over the last 15 months or so?
Well, I can respond to this. The Chief Medical Officer has had one round of consultations with the minibus drivers, and I know there are some issues there, and you are correct. And we have been told that there's another round of consultations to be had. So we are hoping that the Minibus Association will join with us, and we can come to some arrangement based on the advice of the medical fraternity and based on the advice of people who are monitoring the science. But again, our focus is to stem the rapid increase in numbers. And while we are focusing on this, of course, the earlier question about nutrition and so on, yes, this is part of the whole COVID-19 response. But our most urgent priority now is to do everything that we can to stem the rapid rise in the cases.
Okay, we'll take 2 more questions before we wrap up. Yes, Ms. Shalmine?
Okay, this is the second time for the year that we are over 1,000 active cases. The first time was back in February. And that is what I believe prompted the 7 p.m. curfew, the reinstitution of the state of emergency, a ban on liquor sales and things of the sort, very rigid measures as compared to what's happening now. And we did see the number of active cases drop to double digits at some point. Why not follow what seemed to have worked back in February?
We are being driven by the science. When the science advises, we will do.
It's okay. So I know it's not you making unilateral decisions, and it is a more technical team providing guidance and advice to the command center for final decisions to be made. Is the science any different?
We're going to be driven by the science. When the science advises us, we're going to do exactly what the science says.
Okay, so just for my clarity purposes as a citizen, not even a journalist at this point, as a citizen, what exactly is the science telling us?
Exactly what we did.
Okay.
But we also have to note, Ms. Shalmine, that every body which is being consulted, so for instance, the executive of the SLMDA met last night, and they have called a general meeting of their membership today. So we don't want to leave anyone out. We would have hoped that some alacrity would have been in place in terms of people meeting and giving in their proposals, but that has not happened. And I think, the cases and the testing, and we're very encouraged by that people are being tested, is happening very rapidly. So once all these bodies, because we have the Minibus Association, we have the SLMDA, we have our command center, everyone is meeting and ongoing right now. Once we have all that information, I do believe that If the protocols need to be adjusted, they will. But right now, the protocols which are in place were a guide based on the information available for the past 14 days. Has to be changed. I am sure that the Prime Minister will take the directive from the command center as advised.
Okay, my final question, we are still under a state of emergency, something that when in opposition, the St. Lucia Labour Party opposed vehemently. I believe we are until sometime next month. Any plans to extend the state of emergency?
We're going to, again, we're not looking into the future. We'll do what is necessary to stem the rising tide of COVID.
Thank you, everyone. No more questions. Well, I think we had our last two. So, one more, Judy.
I wouldn't mind following the science as well, or back to following the science. It is proven to be more transmissible of a virus indoors, like in an environment that we're in right now. Is there any plans for the government as far as recommendations towards keeping doors open, windows open, less use of air conditioning, and actually promoting people to be outdoors more? I've noticed that there's been a lot of, for lack of a better word, berating of citizens for being on the beach, for example, when the beach is actually a very healthy environment, and that the rate of transmission in bright sunlight, breezy environments is extremely low, while rates of transmission in these environments are extremely high. It's part of the government strategy towards education of the nation.
Yes, thank you, Julie. It's the approach. This is why we have everyone involved. You see, too many times in the past in this country, we've had decisions made by people who do not have the basic background except their political motives. This is changing. This government is a government of consultation, a government of inclusion, a government of putting people first. We're going to be speaking with everyone. Everyone. And this is why education. We're going to be speaking to people. We are not going to, this Prime Minister is not going to be on his bully pulpit decreeing. It's going to be discussion. It's going to be getting all the minds together to come to a consensus, and that is how we are going to approach it. From you, we welcome your ideas. From everyone, we welcome from the press, from the journalists, we welcome their ideas. This is what we want to do. We want to have a consensus of ideas, the minds together to do something that will benefit, and do things that will benefit the people of St. Lucia. To benefits for the people of St. Lucia. All minds must contend, and all ideas must come to the fore, so together we can take a decision. We are not going to be having a top-down approach. Our approach is going to be bottom-up, speaking to people, hearing from people, and taking decisions to benefit the majority of the people.
Mr. Prime Minister, Mr. Minister, Madam Press Secretary, a press conference is being questioned by the public. The public are asking why this press conference. It seems like it's just a regurgitation, and why not have it after the consultations, which you said are supposed to take place
because
today?
Before this was very important for the public to know what's happening. For us to talk to people. When the command center meets, we're going to be speaking to them again.
Yes. Thank you, members of the press, for your questions. Thank you to the public who channeled their questions through members of the press. And again, this government is here to, again, as the word for today, consultation, to consult with members of the public, members of the press, to hear and to share the ongoing works of the Ministry of Health in the fight against COVID-19. So we do thank all for tuning in. We will be with you with an update between today and tomorrow, if in case that there are adjusted protocols. But we will like to appeal all St. Lucians to wear your mask, sanitize, practice social distancing, the areas of high socialization. So please be guided, and let us not have any confrontation with the police or anyone in law enforcement. Thank you for joining us. My name is Mondi Lewis, Press Secretary to the Prime Minister. Have a good day.
Thank you.